Since 2016, there have been multiple changes to the ACA that have impacted healthcare access and affordability for many Americans. In 2017, the Tax Cuts and Jobs Act was enacted into law. Throughout 2017, Republican lawmakers were persistent in their efforts to repeal the Affordable Care Act. While this never ended up happening, the Tax Cuts and Jobs Act did eliminate the ACA's penalty for people who decide to remain uninsured. The government still encourages people to obtain health insurance, but there are no longer financial consequences for those who choose not to. After this individual penalty was removed, it was expected that people would abandon their insurance plans and that premiums for those who kept their insurance plans would increase. In actuality, there was indeed one round of fairly significant rate increases in 2018. However, since then, rates have been more stable, staying mostly unchanged or just slightly increased over the last few years. Enrollment in individual insurance market has also been stable thanks to other ACA modifications such as the American Rescue Plan and the Inflation Reduction Act of 2021. The American Rescue Plan Act was enacted mid-pandemic in 2021 in order to provide financial assistance for individuals, businesses, and local governments that were greatly impacted by COVID-19. Part of this act included extending eligibility for ACA health insurance subsidies to people buying their own health coverage who have incomes over 400% of poverty. This plan also increases financial assistance for low-income people who were already eligible for the benefits under the ACA. This was originally intended to be only for 2 years. However, the Inflation Reduction Act of 2021 extended these subsidies until 2025. The effects of these two changes have resulted in increasing access to health insurance to those who need it the most during a vulnerable time by expanding insurance subsidies and decreasing total cost for many people.
When we talk about the status of the newly covered, we have to realize the pitfalls of the American demographics. America is a vast and wide country that has many socioeconomic groupings, ethnic groupings, tribal affiliations, and other demographics that face healthcare inequalities on a daily. And with that being said, the rough estimation of about 20 million plus Americans who've become newly covered due to the American CARES Act is a huge precedent in healthcare reform. In January 1st of 2014, the American Health Care Act gave states the option to expand Medicaid to more low-income adults and families and establish subsidies for low-income to moderate families that could get private coverage through a public health care insurance marketplace. This was a precedent because never before in governmental subsidized insurances would you be able to be low income, but also get privatized healthcare, meaning you would be able to go to Blue Cross or other private healthcare organizations and enroll. That was something that was extremely new at the time. But we also have to realize the American healthcare system is extremely fragmented. So, of course, there are pitfalls that vary state to state. And when we talk about demographics, we also have to realize that specific states did not get the same coverage as other states. Some of the deep southern states have low enrollment due to lack of understanding, political affiliation, or just because the ACA was not heavily publicized there due to the affiliation with the political party that brought it into office. So that is a stipulation when we look at the dip in enrollment that a lot of people need to realize and think about. And also healthcare plans traditionally do vary state to state. One state might have full coverage, another state might have partial coverage, other states might have something in between.
The Health Insurance Exchange, also known as the Health Insurance Marketplace, is a place where individuals may go to learn and purchase health insurance. This was created to promote competition between insurance payers, which could ultimately create better healthcare options for consumers. The exchange is used by those who are either eligible for Medicaid or need to buy self-coverage. This was used by over 14.5 million people in 2022. Nearly all residents of the U.S. can use the Health Insurance Exchange if they require coverage and are eligible for enrollment. Mandated by the Affordable Care Act, each state must provide a marketplace where consumers may go to learn, compare, and enroll in health insurance plans eligible to them. Funding provided by the Affordable Care Act allowed states to create their own exchange within a few years after the ACA was passed, going live in the fall of 2013. However, states did also have the option to have federal government step in and run the exchange if they failed to do so, which many elected to do. As of 2013, a type of federal run exchange is used in 33 states, while the other 17 states and DC operate their own exchange. Each state's marketplace is unique and independent as they manage the entire operation. The federally run exchange varies in use as 24 are fully run by the federal marketplace, while 3 are state-based marketplaces that use the federal platform, and the other 6 have a state-federal partnership where the federal marketplace is used but oversight is by the state. The attached figure provides a breakdown of the state's insurance marketplace. The state's exchange status has been known to be ever-changing since the Affordable Care Act was initiated. A few states adopted the exchange early, while others took approaches to oppose the Affordable Care Act. States have changed their exchange approach throughout 2016 to now, mostly dependent on new policymakers and legislation. Changes to the Affordable Care Act does have an impact on health insurance exchange, both federally and state-made changes. Examples include elimination of the individual mandate penalty, expansion of short-term plans, and reduced amount of federal funding for the exchange. In 2018, the Affordable Care Act's individual mandate penalty was eliminated, which impacted the state's exchange as they now implemented their own mandate. Also, in 2017, the implementation of a shorter open enrollment period impacted not only the exchange's program, but also reduced the amount of enrollment nationwide in 2018. All of the states' health insurance exchange, regardless of federal or state managed, had to implement a new schedule and adjust accordingly.
What does Medicaid have to do with the Affordable Care Act, aka the ACA? Medicaid was essentially expanded when the Affordable Care Act was signed into law in 2014. The major expansions started in 2016, and this assisted with expanding coverage for millions of Americans. Americans' interest in healthcare also increased by 44%, and they have seen positive increase with the Medicaid expansion by way of the ACA. Some of the major examples of Medicaid expansion are 62% of the 62% of the newly insured adults were previously uninsured before expansion, and 49% had been without insurance for over 2 years prior to receiving coverage. Health insurance for single individuals without children in both rural and urban areas increased by 68% after the expansion period. Childless adults in rural areas also saw an increase of 1.9% of coverage compared to those in urban areas. Health insurance coverage increased for low-income adult workers. Uninsured rates dropped from 35% in 2013 to 26% in 2014 after the expansion period. In the figure to the right, you will see the status of state Medicaid expansions in 2021. In 2021, we still had 12 states who have not expanded their Medicaid, and then we have 39 states who have expanded Medicaid. Overall, Medicaid has had great increases in insured individuals, and hopefully we can get the rest of the states to hop on board so more Americans can have health insurance coverage.
Since the 2016 election, health insurance premiums on the Affordable Care Act have been affected. 2017 insurance premiums increased. Health insurance premiums on the Affordable Care Act's marketplaces and exchanges increased faster in 2017 than in previous years due to a combination of factors, including substantial losses experienced by many insurers in the market and the phasing out of the Affordable Care Act's reinsurance program. As a result of the losses in the market, some insurers like United Health and Aetna announced their withdrawal from the Affordable Care Act marketplaces or the individual market in some states. 2018 insurance premiums continued to rise.
Premiums rose significantly in many counties across the country, in part due to the decision of the Trump administration to cease payments to insurers for cost-sharing reductions. Insurer participation also declined in many areas, leaving more counties with only one insurer, which likely contributed to the high rate of premium growth. In 2019, insurance premiums decreased. Premiums decreased on an average across the United States in 2024. However, premium changes varied widely by location and by metal level, including premium increases in a number of counties and plans. Additionally, the amount in an exchange enrollee actually paid in premiums depended largely on their income, as most enrollees received significant premium subsidies, and the difference in cost between the benchmark plan and the premium for the plan they chose. 2023 insurance premiums increased. The American Rescue Plan Act increased and expanded subsidies temporarily in 2021 and 2022, and the Inflation Reduction Act extended those enhanced and expanded subsidies through 2025. Premiums increased on average across the United States after 4 years of slight declines. However, premium changes vary by location and by metal level, with premiums decreasing in some cases. Although the sticker prices for many plans are increasing, what a given person pays depends on their income, location, and the differences in pricing between their selected plan and the benchmark silver plan. Because of Inflation Reduction Act subsidies, enrollees with income between 100% and 150% of poverty qualify for $0 premium or nearly free, requiring a nominal payment to cover non-essential benefits. And lowest cost silver plans with substantially reduced out-of-pocket costs. Many enrollees with incomes over 150% of poverty can similarly qualify for free or nearly free, lowest cost silver and bronze plans, depending on their geographic areas.
Ever since the establishment of the HCA, it has been met with cheers and also resentment. In 2017, the Republican Party tried its best efforts to get the law repealed. However, with the HCA being passed over a decade now, the topic is still a source of political debate, mainly as it represents these three areas of healthcare: cost, access, and quality of care. As it relates to cost, since the establishment, the cost of prescription drugs has cost less. This is significant because in retail, prescription drug spending costs about 12% of the total personal cost of care for a person in the United States since 2019. As it relates to insurance, insurance companies cover people with pre-existing conditions, offering many benefits. However, this comes at a cost, raising premiums for many Americans with healthcare insurance. In access, reports show that the ACA has helped increase access to healthcare in states have an estimate of 60% in coverage gain since 2014 and 15 alone. This is due to the extension of the Medicaid Care Act and also of another 40%, and is attributed to unsubsidized marketplace. Finally, for quality of care, the ACA requires insurance companies to spend at least 80 to 85% of their health insurance premium dollars on health care quality and quality improvement, with emphasis to prevention. The ACA emphasizes prevention by investigating in wellness. By staying well, you may be able to avoid the lesser impact of many of these diseases. and their accompanying cost.
After discussing the many modifications made to Patient Protection and Affordable Care Act, it is crucial to emphasize it given the current state of the HCA and healthcare policy in general. Policymakers face several difficulties. Among these difficulties are number one, healthcare accessibility. The HCA has increased healthcare accessibility. Nonetheless, despite the expansion, millions of Americans continue to have inadequate or no insurance. In 2020, there were 9.7% uninsured people of all ages. 11.5% of these total people were under 65 years. 5.0% of younger population lacked insurance, while 27.5 million, that is 13.9% working age adults, were uninsured. The issue of ensuring that all Americans have access to cost-effective, high-quality healthcare will require continued discussion among policymakers. Number two, cost control. Healthcare expenses are on the rise, and Americans spend the most percent of any developed nation. The amount that employers and employees pay toward premium continues to climb faster than workers' income and inflation over time. Despite the country's robust economy and low unemployment rates, average family premiums have climbed by 54%, and employee payments have increased by 71% since 2009, outpacing salary growth of 23% and inflation of 20% by a wide margin. Policymakers will need to take cost control measures into account, such as advocating for preventive care, cutting back on administrative expenses, and negotiating prescription pricing. Number three, protecting people with pre-existing conditions. The HCA consumer protection provision, which include protection for people with pre-existing conditions, are under threat. 54 million non-elderly adults had a pre-existing condition before the pandemic that would have led to a denial of health insurance on the individual market before the HCA. And more than 100 million has a condition that would have likely led to higher premium or cover limitation. The continued availability of affordable health care for those with pre-existing conditions will require new policy from policymakers. Number four, sustaining Medicaid expansion. Some states have not yet expanded Medicaid, despite it being a crucial part of the HCA efforts to increase access to health care. About 36 states have expanded their program, and the District of Columbia have done so thus far, while 14 states have not yet done it. In order to protect Medicaid coverage for people who have obtained it as a result of Medicaid expansion, policymakers will need to keep pushing states to extend the program. And the fifth one is addressing health disparities. Inequalities in health outcomes between various racial and ethnic groups and socioeconomic classes continue to be a serious issue in the United States. Strategies for correcting these inequalities and guaranteeing that all Americans have chances to achieve good health will need to be developed by policymakers.
The Affordable Care Act has been controversial since its passage. Many of its proposals have been put forth to overturn a portion of the law, including the individual mandate, which require individuals to pay a penalty if not insured. This provision was repealed in 2017 by the Tax Cut and Jobs Act, and the penalty is currently set at $0. Other issues raised include community rating, shortage in healthcare staff due to more people being covered, and as discussed earlier in the PowerPoint, premium increase. This arguably a result of younger, healthier individuals between the ages of 18 and 32 choosing not to enroll. On the contrary, ACA is a result of a number of provisions that expand insurance coverage, improve insurance's affordability, and access. 52% of the population found ACA to be favorable and 41% unfavorable. Medicaid expansion include coverage for residents at or below 138% the federal poverty line. Reforming of the insurance market consists of setting up health insurance exchange,
which allows individuals to compare insurance companies' rates and benefits. Insurance coverage now requires insurers to provide a total of 10 essential health services, including annual checkups and preventative care. It also prevents insurance from denying coverage and charging higher premiums for people with pre-existing conditions, as well as allows for children to remain on their parents' insurance till age 26. Cost. The Medicaid expansion cost was calculated at $128 billion, way less than its $172 billion projected cost. Financial protection decreased in and out of pocket costs for those enrolled in Medicaid, resulting in better or improved overall financial well-being. Impact on health. Studies indicate states that adopted expansion of Medicaid show a reduction in mortality for cardiovascular causes among middle-aged adults and end-stage renal disease at 1 year. These examples given are non-inclusive on what has been accomplished through ACA. All in all, despite a fractious legislative path to enactment and similar contested rollout, the ACA has been beneficial for Americans and has showed well-documented effects in reducing the percentage of uninsured Americans to historically low levels. Available studies also show an association between obtaining health insurance under the ACA and improved access to care, reduced financial burden, and possibly improvement in health status among affected population. The Affordable Care Act benefits have far outweighed its detriments and has succeeded in its goal of making health insurance available to all at an affordable rate.